Happy Friday, Baylor College of Medicine and friends of Baylor. We're on site at the Ophthalmology, famous Cullen Eye Institute, with Dr. Conwell and Dr. Weichert to explain to my sister, who knows nothing about ophthalmology, but has sent her husband here for cataract surgery because he had narrow angle glaucoma or something. So first of all, Janet, can you explain to me what a cataract is?
I'll let Dr. Kendall take
Well,
that.
a cataract is basically the natural lens implant. We're all born with a lens in the eye, and it becomes cloudy with time. Usually in your 50s, 60s, beyond.
Watch it now.
Sometimes a little earlier if you're lucky enough. With that being said, when it starts to really affect the vision, that's when we start talking about cataract surgery. And that's where one of us, Dr. Weichert, myself, or some of our amazing colleagues here, will go in and actually remove that cloudy lens and put a new lens implant. The lens implant is what we all talk about. There's a lot of work that goes into picking this new lens implant.
So the cataract replacement has been almost, democratized. People do, you can do them by the thousands, but you guys are developing new technologies, and so I want to hear about that. So what is different about the lenses you're putting in these days? And it's got to seem cool, because if it's not cool, no one's going to be interested. So what's cool about the new lenses that you're doing?
Absolutely. Well, the work that's usually done is all actually putting the lens in. Lots of formulas, lots of work on how perfect the cornea is in order to pick that perfect lens implant. But we now have technology where you can actually adjust things afterwards.
Dr. Weichert is going to speak.
Yeah,
He's not just my prop.
We had arranged for
No,
different
go ahead. We
responsibilities.
really love you. So tell us about the new technology.
Yeah, so when we're choosing the lens to put in the eye, everybody always says, give me that 20/20 lens, and it doesn't quite work like that. We are choosing a lens so that you have a certain residual prescription in your eye, meaning, a little bit of nearsightedness, farsightedness, or nothing. So, but reaching that goal can be challenging because basically we're measuring the size of the eye, and then we're trying to guesstimate where the lens will sit in the eye. And so there's always variability in that guess. So to overcome that now, we have a lens that we can put in the eye, see where it ends up, and then adjust it afterwards. So if you end up a little bit nearsighted, we can take that away. If you end up a little farsighted, we can fix that. So it actually is a way of overcoming some of these obstacles.
I didn't know that. Okay, that's very cool. So how does it do? Does it change the bending of the lens, or how does
Some
it?
of it's proprietary.
It can't be.
Yeah,
You'd have to
exactly.
kill me if I knew.
But, essentially, after the lens is placed in the eye, whether it's 3 weeks or 4 weeks later, we start doing treatments. And it changes the dynamics of the actual lens, changes maybe where the molecules are to maybe correct the farsightedness, correct the nearsightedness, correct the astigmatism. But the best part about it, it's not based on anything that we measured. It's based on what the patient says. So how amazing is that, right? You want cataract surgery, you have cataract surgery. Afterwards, you're like, I want a little distance, I want a little near, I want maybe a little monovision where one eye's distance and one eye's near. And it's so amazing to be able to actually listen to the patient and then do treatments based on what they're asking for.
So what role did we play as an institution in getting this kind of technology approved? Yeah.
So one of our bigger challenges today with choosing lens power is in our LASIK patients or PRK patients where we've changed the cornea, and that's hard to measure, and it also really throws a wrench into the prediction of where that lens will end up in the eye. So by having this technology, we're studying that in our patients that have had these prior surgeries to try to figure out what's the best way to manage those.
So a lot of people talk about LASIK surgery. They get that done everywhere, so they don't have to wear glasses. But when does it go from LASIK to actually where you're manipulating the intrinsic lens to having it replaced? When is there a magical thing, the decision moment? Is it just when it's cloudy you can't see, or are there times that's it?
Yeah, it's pretty much when, they've reaped the benefits of LASIK for however long, few decades maybe, but then the lens in their eye is changing over that time period. So when the lens clouds up enough, as Dr. Canwell said, to where it affects their vision, that's when we step in and remove that lens and replace it.
So let me ask you one other question, because my sister asked me this. People start off with this vision, and then as they age, they get farsighted, and things.
Arm doesn't get long enough.
Can you move it back? Yeah, so what causes that?
Yeah, We don't actually know. There's some theories, right? Is it the muscle moving the lens? Does that change? Does it age with time? Does it stiffen? Something about the actual lens where you can't do multiple focal points. There's so many lenses out there for cataract surgery. We're trying to do the holy grail. How do we get the lens that we put in the eye to be like that 20-year-old lens that can do it all? And so that's the nice thing about this new technology too, which we here at Baylor are measuring using some things that are outside of the company actually, that have to do with the research here, is these new lenses like the light adjustable lens. How much depth of focus can we get? Can we get it all? Distance, intermediate, near? Can we get just distance and intermediate? What goes into that? And that's kind of the exciting stuff that we can do with a lens like
That's
this.
very cool. So all kinds of great stuff happening here. Thank you guys for spending some time with me. We're always excited about what goes on in the Cullen Eye Institute. So thank you very much, Dr. Condwell and Dr. Weichert. Thank you. And we will be visiting you, and I think we're going to visit with some patients that have been cared by you as well. Great. When I was growing up, all I did was watch the Yankees beat the Indians. Mickey Mantle, Roger Maris, the 61, 62.
I remember all that stuff.
Oh, you were there. You were in the Bronx. Okay. Well, now that we know. So everybody eventually ends up in Houston.
I have a very unique perspective.
You
on
are
what
an
do.
ophthalmologist. So you had, and you had a,
over 20,000 cataracts.
Really?
Over 20,000 LASIK. And
Wow.
thousands of multifocals. So I have a
you
very,
actually know what you're talking about.
I have a very unique perspective.
So tell me what the procedure you had that was.
I had the light adjustable lens.
And so how is it?
It's the best vision I've ever had in my life.
Really? So how does it work? Does it adjust based on the light?
No.
No.
That's the lens itself can be adjusted after the surgery.
I see.
What the light adjustable lens gave me was the ability, we can get close, but then we can adjust it afterwards.
Oh, that's awesome.
the adjustment of the
I
light
see, I
adjustable
see.
lens. So they got me close, I was in the ballpark, and then I had one, you can have up to 3 adjustments.
Mm-hmm.
I had one adjustment, and I'm waiting to have a second. They usually like to lock it in 6
I see.
weeks. My vision, I can read one letter on the 2010 eye. I have monovision,
Mm-hmm.
where I have very minimal nearsightedness in one eye, and I have distance vision in the other eye.
Does that freak you out at all when you?
No, not at all.
You just get used to it. I look at this eye with that, and I look at that one.
Instantaneously.
Oh, wow,
I don't
that's
have
awesome.
to flip. And I can read for extended periods of time without glasses. I can drive under any condition. You don't have enough time to have us talk about the medical aspects and the optical aspects of how wonderful this one.
That's so great. Well, congratulations. Thanks for spending some time and talking about it. We appreciate it. Thank you for doing this.
You're welcome.
And your eyes look great. All right, I want to end today with a couple of shout outs. First of all, congratulations to Dr. Beacom Boskert, the professor in the Department of Medicine and Cardiology, who's been awarded the Heart Failure Society of America Distinguished Leadership Award for 2024. To get all those words on the trophy requires a thing 40 feet wide. But anyway, it recognizes a leader in the field in the areas of education and mentorship. She's also the director of the Winter Center for Heart Failure and specializes in heart failure and cardiac transplantation. So congratulations, Dr. Boskert. Also, congratulations to Dr. Rachel Davis, Associate Professor of Anesthesiology and Program Director of the Doctor of Nursing Program, was chosen as a Fellow of the American Association of Nurse Anesthesiology. This is designation distinguishes a certified registered nurse anesthetist as being a premier anesthesia provider. So thank you, Dr. Rachel Davis. I also want to congratulate Vicki Waters, Assistant Professor and Associate Director of the PA program, Physician Assistant Program, who was selected as a Distinguished Fellow for the American Academy of Physician Associate Distinguished Fellow Program. These individuals are selected because they stand out in their professional lives, whether through innovation in medical practice, serving the community, or taking leadership roles. And finally, tomorrow marks the annual observance of Armed Forces Day, which is time to honor men and women who currently serve in the armed forces of the United States. This is the culmination of Armed Forces Week, in which each branch of the military is honored on a separate day. We really thank you for your service, and a special shout out to Claire Bassett's son, who what is he now, a ranger? Jump ranger. Is that what it's called? Jump master. Congratulations. Happy Armed Forces Day to everyone, and I can't wait to see you next week.